So start, please.
Good afternoon, everyone, and thank you for logging in for today's Facebook Live session. Today, we are talking about one of the most crucial chapters of your IVF journey, and that is ovum pickup. Do we need to worry? For today's session, joining with us today is Dr. Nilesh Balkawade, sir, who is the clinical head of Oasis Fertility Pune. Welcome, sir, for today's session.
Thank you, Dr. Rashmi. Thanks for that.
Yeah. So OPO is one of the only surgical steps that is mandatory in every couple's IVF journey. So today we'll be delving into some of the details of the process by itself. So, sir, one of the first questions that come up are what are the prerequisites or what is the sort of care that is to be taken before the OPO procedure itself? One, through the patient's perspective, and second, through their partner's perspective.
Yeah. So first, let me talk about ovum pickup or OPU procedure. Basically, ovum pickup is a crucial aspect of the IVF journey. Uh, we have to get the eggs outside your body so that we can fertilize them outside your body. That is called as in vitro fertilization or fertilization outside the body. So during IVF, we give the patient gonadotropin injections so that we can produce superovulation or more number of eggs in both of your ovaries. We do the assessment on ultrasound, or again, we do the assessment by doing certain hormonal tests such as serum estrogen levels and progesterone levels. After that, on the day of your trigger, that is the final injection which you receive for oocyte maturation, on that day, you are told about the day of your ovum pickup. Certain instructions are given to you on that day, and these are the prerequisites. So, on the day of your trigger, I will start from there that your last injection of hormones, that is gonadotrophins, is scheduled on that day, and you have to take it as you take regularly according to the dose decided by your doctor. The day mostly in the evening you have your trigger injection, because so that your ovum pickup procedure falls around 35 to 36 hours after the trigger injection.
Okay.
So this, during the trigger, you have to report to the center where you are supposed to take your trigger injection around 15 minutes to half an hour before time, so that your injection is received by you on time. The trigger injection can be of two or three types. It can be a HCG trigger, it can be an agonist trigger, or it can be a dual trigger. So once
Okay.
you receive this injection, it's mandatory that we do the ovum pickup procedure exactly 35 to 36 hours after that, and there should be no delay, and that's very, very important. On the next day of your trigger, you may be called for some hormonal tests, or you may be called for pre-anesthetic evaluation, which has to be done a day prior. After that, you need to be aware of the precautions you need to take on your ovum pickup day. So, suppose your trigger injection goes on the last day at around 10 p.m., you are supposed to have your oocyte retrieval or ovum pickup procedure the next day, 35 to 36 hours after, that is around 9 a.m. to between 10 a.m. That is the time the procedure would be scheduled according to your fertility specialist. You have to report to the center 1 hour prior to the procedure.
Okay.
You have to come nil by mouth, that is, you don't have anything, not even water. If you are hypothyroid and you are taking some thyroid medications, you need to take a dose of thyroid medications around around 6 a.m., that is around 3 hours prior to your procedure, with one small sip of water. If you are antihypertensive, again you need to take your antihypertensives as you are taking. But if you are diabetic and you are taking either tablets or insulin, you need to skip the morning dose, because you are going to remain nil by mouth. So,
Right.
if any dose is required, you will be given that dose during the procedure or just prior to the procedure.
Okay.
We need to be aware that all these gametes are extremely sensitive. That is, the eggs and the sperms both are extremely sensitive to any VOCs. Okay, VOCs are small particulate matter or some smell or some other material which is present in the air, which is going to affect the quality of your eggs and the quality of embryos. And that's why we need to be sure that while walking into the operation theater for ovum pickup, we have not applied any perfumes, any any other solvents like nail paints or something like that, or any body fragrances or talcs, so that you don't end up in causing problems with your own gametes. So this is very, very important that this care needs to be taken, that while walking into the operation theater for oocyte retrieval or ovum pickup procedure, you enter it uh, barely, like bare, without any other cosmetics. Another
Okay.
thing is that you can take care of your genital hair by doing a clipping. It may or may not be done. You need to ask your doctors before you do that.
Okay.
Along with that, you need to be absolutely relaxed and know the procedure, what you are going to undergo. We'll be talking about the ovum pickup procedure so that you come to know what the procedure actually is, and you need not be stressed about that procedure because it's a very simple procedure.
Right. So any care for the partner?
Yeah. So prerequisites for the partner are also important. As we know that ovum, we need to do IVF by mixing the egg and the sperm outside the body, and this involves giving a semen sample as well. And therefore, the male partner should be able to give a semen sample on the day of ovum pickup, and that's where an abstinence period of around 2 to 3 days is recommended. So once your trigger is planned, you have 48 hours in hands,
Okay.
and thereafter you should have an abstinence, or even one day prior to the trigger is also okay. So around 2 to 3 days of abstinence is must before you give the sample for IVF, and you should be mentally relaxed. There should be no addictions, and you should be reporting again with your partner, that is your wife, in time, so that you are able to give the sample. If there is any difficulty in giving the sample, like there are problems of erectile dysfunction, or the patient is not able to produce sample on his will, in that case you can ask your doctor for option of semen freezing, so that
Okay.
during this whole IVF procedure, whenever you get time, you can give the sample. Either, usually better to give it in the clinic, but if you're not comfortable, you can give the sample at home, and the home collected sample can be brought within half an hour and given to the clinic, which can be frozen, so that you don't land up in the problems on the day of pickup where you are not able to produce sample. If
Right.
the partner is having severe oligospermia, that is a very drastically reduced sperm count, or if the partner is having azoospermia, that is the sperm count is zero, any procedure for the partner is also planned on the ovum pickup day. These procedures can be testicular sperm aspiration, that is the TISA, or microsurgical testicular sperm extraction, that is the microtesting. So if these
Right.
procedures are planned, again the same instructions what are given to the wives is also given to the male partner. That is, they have to come near by mouth, they have to take their oral medications of hypertension and thyroid, if any, and they have
Right.
to report without any cosmetics into the operation theater. Uh, yeah, that's it.
Okay. All right. So when exactly do we plan for this ovum pickup procedure? Is it the same in every woman, or is there a variability? When can they expect?
Yeah. So usually the IVF stimulations go for around 10 to 12 days. This depends upon the stimulation of that patient, like the response to the stimulation. So if the response to the stimulation is good,
Okay.
and if the follicle reaches dominant size, that is the size which is which would be appreciated and give a mature follicle. If that size is reached within time, then we can give the trigger. So it is around 10 to 12 days, and around 35 hours to 36 hours after that we can plan a ovum pickup procedure after the trigger. So this depends upon the number of eggs present. It depends upon which trigger we are giving, and it also depends upon the experience of the clinic and their protocols. Sometimes it can be 35 hours, sometimes it can be 35 and a half hours, and sometimes it can be 36 hours. Depends upon uh, the patient factors. also depends upon the number of eggs and also depends upon the protocol of that clinic.
Okay, so it's a variable sort of range.
Yeah.
Okay. So what type of anesthesia is used in this procedure, and can we do it without anesthesia?
Yeah. So ovum pickup procedure is usually involves a prick of a needle. It's not a very big procedure. It doesn't involve any cutting or any sutures or any blood loss in during this surgery. It's a normal procedure where a transvaginal probe is used, and the transvaginal probe is advanced till the ovaries are reached, and the ovaries come in near contact with the vagina, and a needle is passed over a guide on this transvaginal probe, and this needle directly enters the vagina. It pierces and crosses over and pierces the ovary. Now, this piercing of the needle is going to cause some pain, and that's where the role of anesthesia comes, because we want a procedure which is without any pain. So overall, all the IVF cycle goes without any problem and without any pain, and that's why we want this procedure as well to be without any sort of pain. And therefore we can give
Right.
a short anesthesia, which is a general anesthesia, for around 15 minutes to 30 minutes, depends upon the number of eggs which are
Okay.
present. And this is the most preferred anesthesia, so that the patient is absolutely less stressed out, and we can do the procedure with any manipulation if necessary. Sometimes the ovaries may be away from the field, sometimes we may require some manipulation, and this should not cause discomfort to the patient. And that's why uh, general anesthesia is preferred over a local anesthesia. Some centers might as well use local anesthesia for this procedure, but at our center we usually use a general anesthesia. The time duration
Okay.
for action will be around 15 to 30 minutes for this procedure, and therefore the
Okay.
recovery is quite early, and therefore the patient can come to consciousness in no less than half an hour's time.
Okay. So can you describe in process what exactly this ovum pickup is? What happens in the OT?
Yeah. So once in the OT, the patient is counseled about the procedure. The anesthetist tells about the type of anesthesia, and the surgeon tells about the position which is to be given and what procedure is to be done. Once the
Okay.
patient is there on the operation theater or operation table, then an ultrasound monitor is used, and ultrasound probe is used, a transvaginal probe, along with uh, a oocyte aspiration needle and a guide for guiding this needle inside is used. We have aspiration pump, we have a temperature regulator which regulates the temperature into which this fluid from the follicles is going to come and land there. So we have all this in place. Now, under anesthesia, the patient is given anesthesia, and under anesthesia, a transvaginal probe is passed, and over a guide, the ovum pickup needle is guided through from the vagina into the ovaries, directly into the follicle. So the follicle is seen on the screen, and we directly enter the follicle without any causing any problem to any other structures. So this is done in the best possible way by an experienced surgeon, and we try to remove
Oh,
the follicular fluid outside. Now, this follicular fluid is going to contain the egg, which is the female part of the embryo. So, this follicular fluid is then assessed under the microscope, and we see for the egg. After we see for the egg, these eggs are retrieved, that is, they are removed from this fluid and kept in a separate dish for few minutes to hours. And after this, the
okay.
if the IVF procedure is going to be undertaken, then the sperms are placed around the egg. If the ICSI procedure is going to be undertaken, it is the intracytoplasmic sperm injection, then these eggs are denuded and their cumulus complex is removed, and we see the egg only with zona, and then we can see how many eggs are mature, how many are immature, and in the mature eggs we can introduce a single sperm by the procedure called as intracytoplasmic sperm injection. And this procedure
Okay.
is usually done around 2 to 3 hours after the ovum pickup procedure. And after doing this ICSI procedure, the uh, embryos to be formed are placed in ideal culture conditions for the next 3 to 5 days. So this is how the procedure undergoes. And after this procedure is completed, The patient is examined for any problems and then shifted outside the operation theater.
Okay. Can there be any sort of complication during this procedure itself, during the ovum pickup?
As I told Dr. Rashmi, this procedure carries very less likely risk of any complications in the experienced hands, and
Okay.
usually the needle can cause some pain if the patient is not anesthetized. If there can be some amount of bleeding if the needle prick continues to bleed later on, but these are quite rare complications, and we don't expect any major complications in experienced hands. If there are any
Okay.
problems like endometriosis, if there are problems like adhesions where the ovaries are placed away from the vaginal probe, then there can be certain problems which can be anticipated, but these are specific only for that certain group of patients. If there is
Okay.
endometriosis and endometrioma is inadvertently damaged, there can be a risk of infection. So, of course, all the care is taken so that we don't cause any serious problems while doing this procedure. And most of the times, this procedure goes without any hiccups.
Okay. And any sort of long-term sequelae or any long-term problems that we've seen after this procedure?
Usually, we don't see any long term problems with this procedure. Uh, as I usually say, that ovulation, that is the ovarian hyperstimulation during IVF and the ovum pickup procedure should be done for minimum times as possible. Like if we would be happy to have your first IVF successful, but that's not the case in every patient. So we may have to undergo second or third pickups or stimulations accordingly. Usually, keeping the number of pricks into your ovary to the less number as possible would be beneficial so that we decrease the amount of bleeding. We also decrease the chances of infection, if any. And the vaginal toileting or vaginal cleaning should be thoroughly done so that any sort of infection doesn't go inside. So all this care has to be undertaken, has to be taken. Sometimes the ovaries are quite enlarged, and this can cause twisting of ovaries and pain sometimes. But also, these things that the
Oh,
ovarian torsion can also be analyzed on sonography later on. So, this near short term or maybe near long term complications, that intermediate complications can occur, like the ovarian torsion, which we need to be aware of. Uh, we don't expect any major complications which will be long term sequelae of this ovum pickup procedure.
okay. How soon after this procedure can the patients be expected to like go home? Is it a
So usually,
daycare procedure?
yeah, usually this is a procedure which takes around 15 to 20 minutes, but anesthesia which is given is general anesthesia, and the complete recovery of the patient after general anesthesia happens to be after 3 to 4 hours. So the patient has to take a rest after this procedure is done for around 3 hours, and thereafter the patient is analyzed for any symptoms or any problems with the pulse, blood pressure, and vitals. And if the patient is okay, the patient walks off on her own uh, without any problem on the same day, that is the same afternoon. So the patient is not kept in the hospital for more than 4 to 5 hours. That's the maximum time which is kept for the patient. Sometimes the patient may have some amount of pain in the post-operative period because we are touching the ovaries with the needle, but this pain is taken care of by
Right.
analgesics. If the patient is a case of PCOS, there can be some amount of hyperstimulation, which can cause some bloating sensation and constipation later on. This also can be taken care of by giving certain medications. If the patient has had any chances of hyperstimulation, the patient is called back on day 3 after the pickup, and we do an ultrasonography of the patient to see if the patient is okay.
Okay. Okay. So post procedure, is there any care from the patient's perspective that they need to take on the day of the after the pickup or 2 3 days post when they go home? Is there sort of anything that they need to do?
Yeah. So I think the ovaries are quite enlarged and um, than the size of normal ovaries. Therefore, a heavy exercise or a rigorous exercise should be avoided. This also includes having sexual contact probably because of the risk of torsion. So one should be careful while performing heavy or strenuous activities due around the time of ovum pickup, maybe 1 or 2 days prior and around 2 to 3 days after ovum pickup. This care needs to be taken that the patient should be gentle in doing exercises. A gentle walking is definitely allowed, no problems with that, but a heavy exercises should be prevented after ovum pickup. The diet of the patient should contain high protein diet, especially if the patient is a PCO and has a chance of hyperstimulation. The patient needs to take certain medications advised by the doctor after the ovum pickup surgery, so that they should not miss these medications, because if the patient is having fresh transfer of embryo, the patient needs to be on progesterone or a luteal phase support. If the patient is being planned for any repeat stimulation, again the medications are important. So that's why the patient needs to take the medications properly, a diet regularly, and a mild exercise is what we would recommend to the patient after the ovum pickup procedure. The patient might experience some common symptoms which we have already discussed regarding pain and constipation or bloating,
Right.
which needs to be taken care of by the medicines given by the clinic.
Okay. Are there any symptoms post pickup that the patient needs to be alert about? And if that happens, they need to immediately contact their doctor back?
If the patient has severe pain which is out of proportion, one. If the patient notices
Okay.
any bleeding, second. If the patient has any fever, or along with the pain, if the patient has any nausea, vomiting, these are the symptoms which is intractable and not able to control. If the patient has any signs of hyperstimulation like severe pain, maybe difficulty in breathing, weight
Right.
gain, if all these symptoms are there, this patient needs to report to the clinic.
Okay. So if there are any more questions from the audience, we'll be happy to take them. And thank you, sir, for sharing with us these important know-hows about this very crucial aspect of a couple's IVF journey. And for any more questions, you can also contact the helpline number mentioned below, or you can visit us directly at our centers, which are at Kharadi and Wakad. So thank you all for joining us.
Akila, do you have any questions?
Okay, so how long does it take to pick up ovum after IVF?
So as we said that the ovum pickup procedure is usually planned after the gonadotropin injections are over. So how long, if we take it that way, then it is around 12th or 14th day after we start the injections when we have the ovum pickup procedure. How long after the trigger? It is 35 to 36 hours after the trigger injection that we plan IVF. And how long, if we consider in time, then it will take around 15 to 20 minutes for the procedure.
Okay. What is the success rate of ovum pickup?
Yeah, this is a good question if we consider it that way, in a scientific way. This usually we assume that once we see a follicle on the ultrasound, we will be able to remove that follicle, and we assume that that's an egg and that's going to be used immediately for IVF. But that's not the case always. Sometimes we see a follicle on sonography, and we might not be able to remove the egg from that follicle. This is called as empty follicle. And usually I take the question accordingly, that it might be empty follicle. Sometimes the chances of empty follicle are around 10, maybe, or less than 10%. Usually 90% of the times we are able to remove the egg. Now this empty follicle can be a false empty follicle syndrome or a true empty follicle syndrome.
Okay.
If your trigger injection is not received on time, if your trigger injection is not given properly, in that case there can be empty follicle. But most of the times, usually this doesn't happen in a good fertility center.
Right.
What we have is a true empty follicle syndrome, where the eggs of the cells which produce the egg are at fault, and there can be problems with these cells, and therefore we don't have any egg inside the follicle. And that's what called is a true empty follicle syndrome, and we need to manage and evaluate the patient accordingly and treat accordingly.
Okay. So with regards to this question, there's also a question about when do the patients come back to us for discussion? So after the ovum pickup.
Yeah. So after the worm pickup, usually we call the patients on day 3 or day 5 after the pickup, starting day 1 after. So
Okay.
if we consider the pickup day as day 0, then we call the patient on day 3 if it is the if we are doing the culture for day third 3 days, and if we are
Okay.
doing the culture for 5 days, we call the patient 5 days after the ovum pickup. And this is when we tell the patient about how many embryos are formed, what is the grading of embryos, how
Right.
many embryos we are going to insert, whether we are planning a fresh embryo transfer or a frozen embryo transfer. All these things, or maybe a number of embryos transferred is also discussed, the single embryo transfer, double embryo transfer. All these things are discussed third or fifth day after the ovum pickup, when the patient is called back.
Okay. All right. Do we have any more questions? What are the possible complications of ovarian cyst pickup?
Usually, ovarian cysts which are present in the ovary, other than the follicles which are formed, are not touched during ovum pickup because this cyst can be infective. This cyst can be endometriotic cyst, or it can be para-ovarian cyst. We don't want to cause any infection to come into our follicular fluid, and that's why we don't usually touch these cysts during ovum pickup procedure.
Okay.
There is another question here: does AMH affect ovum pickup? So the answer is that AMH will either give produce less number of follicles if the AMH is less, and if the AMH is high, it will be hyper responder, and number of follicles which will be produced will be high. So if the number of follicles is less, there are chances that the egg quality can be low or the maturity of the follicles can be low. This we have to assess and treat accordingly. Sometimes we have to change the trigger also. Sometimes we have to do a worm pickup through a double lumen. If there are less number of follicles, we can do follicular flushing.
Okay.
And if the follicle number are high and the number of, there is hyper responder status, then also care needs to be taken while doing the worm pickup. It needs to be a little bit faster so that we don't lose on time and we aspirate all the follicles which are present. And after doing the worm pickup procedure, we give certain medications so that the hyperstimulation doesn't occur. Also, the trigger planned is accordingly so that the hyperstimulation doesn't occur. So this is how the AMH can affect your ovum pickup procedure. The duration for pickup can also increase if the number of follicles is high.
Right. Do we have any more questions? Okay. What is the ovum pickup method?
Yeah, I think we discussed about it. Ovum pickup method is doing the ovum pickup by oocyte aspiration needle. So there are standardized needles which are available, and we apply a suction pressure to this needle, and we aspirate the follicular fluid and then send it for examination, and from where we find the egg.
Right.
Okay.
Yeah, that's it. Thank you, sir. And
Yeah.
thank you
Thank
everybody for joining us. Yeah.